All right, so today we're diving into a topic that's often misunderstood, the link between crime and mental illness.
Yeah, it can be a really sensitive and complex issue.
For sure, and we're going straight to the source with real research, academic papers, that sort of thing.
Exactly. None of those sensationalized headlines.
Nope, we're cutting through all that to try to understand the real relationship between mental illness and criminal behavior.
We'll look at the myths, the surprising stats, and, figure out what actually drives criminal activity.
So, I guess to start, we've got to address that big question. Are people with mental illness actually dangerous? It's something you hear all the time, right?
Right. That's a stereotype a lot of people believe. But the truth is, most people with mental illness are not violent at all.
Interesting. So they're not more likely to commit crimes.
Actually, studies have shown that they're more likely to be the victims of crime rather than the perpetrators.
Oh, wow. Okay, so what do the numbers tell us? Like statistically, how much crime is actually linked to mental illness?
Well, there was a major study back in 2006 by Faisal and Gran, and they found that only a tiny fraction of violence in society can be traced back to mental illness.
Okay, so how tiny are we talking?
Like really small. For example, schizophrenia was linked to just 2.3% of violent acts, and psychosis in general was associated with 5%.
Wow, that's incredibly low. So it seems like we can't just blame mental illness for crime.
Nope, it's definitely not that straightforward. Just because someone has a mental illness doesn't mean they're going to commit a crime.
It's like correlation doesn't equal
Yeah,
causation.
exactly.
So if it's not just mental illness, what are the things that actually make someone more likely to be involved in crime?
Well, the interesting thing is the biggest risk factors are actually the same for everyone, whether they have a mental illness or not.
Okay, so what are those factors?
Well, the most significant one is substance abuse.
Drugs and alcohol.
Yep, alcohol and drug misuse drastically increases the risk of violence.
Right. That makes sense.
Right.
I mean, we've all heard about the link between substance abuse and crime, but it's interesting that it applies to everyone, not just people with mental illness.
Absolutely. And then another big factor is previous violence.
So if someone's been violent in the past,
Yeah, past behavior is one of the strongest predictors of future actions.
so it's not just about how someone's feeling in the moment, but also about their past experiences.
Exactly. And then, of course, there's things like gender and age. Statistically, men are more likely to be violent, and crime rates are usually highest among young people, like adolescents and young adults.
Yeah, that seems to be a trend across the board with crime statistics.
Exactly. And then you've also got to consider social and environmental factors, things like poverty, lack of opportunity, social inequalities.
Right, like if someone is struggling to make ends meet, they might be more likely to turn to crime out of desperation.
Exactly. So we're starting to see that it's not about one single cause, but more about this complex interplay of individual factors, social factors, and environmental factors.
A perfect storm, almost.
Yeah. And then on top of that, research has shown that certain types of mental illness, when combined with these other factors, can increase the risk of specific types of crime.
Oh, that's interesting. So it's not just about mental illness in general, but also about the specific diagnosis.
Right. And one of the best examples of this comes from the Dunedin study.
To do an study.
Yeah, it's a long-term study that's been following people since they were born, and they found this really interesting connection between alcohol use, cannabis use, and schizophrenia spectrum symptoms.
And that combination was linked to higher rates of crime.
Exactly. So it's not like mental illness alone leads to crime. It's more about how it can interact with these other factors to create a higher risk.
It's all starting to make more sense now. Like it's not as simple as people make it out to be.
Definitely. And just to give you an example of how much nuance there is in this area, there used to be this theory called threat control override delusions.
Threat control override.
Yeah, basically the idea was that if someone has delusions that make them feel threatened or like they're being controlled by an outside force, then they're more likely to lash out violently.
Okay, so like if someone believes they're being followed, they might attack someone they think is the follower.
Right. But further research, especially the MacArthur Violence Risk Assessment Study, actually challenged that whole theory. They found that delusions in general, even those specific threat control override delusions, weren't directly linked to a higher risk of violence.
So that's another myth busted.
Exactly. There's always more to learn and unlearn when it comes to these complicated issues. And to try and make sense of it all, Researchers have even developed a two-type model of violence, specifically in people with schizophrenia.
Okay, two types of violence.
Yeah, they call them type 1. And type 2, type 1 is when someone's delusional symptoms are directly related to the violent act.
So, like, they attack someone because of their delusion.
Exactly, and this type is actually less common.
Gotcha. So what about type 2?
Type 2 is more about having a history of things like substance misuse, conduct problems, and delinquency, so there's this pre-existing pattern of behavior.
So it's not that the mental illness is causing the violence. It's more like it's adding another layer of complexity to an already challenging situation.
Exactly. And it's important to remember that these are just models, they're not perfect, and every person is different.
Right. So there's always going to be individual variation and a lot of different things at play.
Definitely.
This is also fascinating. I'm already learning so much. So far, we've debunked some major myths and started to get a better understanding of what those real risk factors are.
Mm.
But I'm curious, does this all change when we look at different types of crime? Like, are there certain crimes that are more closely linked to mental illness than others?
That's a great question, and it's a perfect lead-in to what we'll be exploring next, diving into specific offenses and seeing how mental illness might or might not play a role.
All right, I can't wait to learn more. Okay, so let's get into those specific crimes then. Where do we start?
Well, how about we tackle a tough one right off the bat, sexual offenses.
Okay, yeah, I think a lot of people assume that most sex offenders have some sort of mental illness, right?
Yeah, that's a common misconception, but the research actually paints a different picture.
Really? So most sex offenders don't have a major mental illness.
That's right. Studies have shown pretty consistently that most of them don't meet the criteria for a major diagnosis.
So if it's not a major mental illness, what are the things that are linked to these types of crimes?
Well, a few things come up again and again. One is the number of previous offenses.
Like the more someone's done it before, the more likely they are to do it again.
Exactly. The type of offense also matters, like offenses against boys, offenses that happen outside the family, and incestuous offenses. They all have different rates of recidivism.
Right, so the specific details of the crime can tell us something about the offender.
Yeah, and there are also psychological factors that play a role, like low self-esteem, lack of empathy for the victims, and distorted thinking.
So not being able to see things from the victim's perspective, maybe justifying their actions in their own mind.
Exactly. And then social isolation can also be a factor.
It seems like we're seeing that same pattern again, that combination of behavioral patterns, psychological stuff, and social dynamics.
Definitely. It's complicated, and researchers have even looked at using tools like penile plethysmography and polygraphs in assessing sex offenders.
Wait, penile what?
Penile plethysmography. It's a way to measure changes in penile response to different stimuli.
Oh, okay, so trying to figure out someone's sexual arousal patterns, right?
Exactly, especially if there are concerns about deviant interests.
I can see how that could be a useful tool, but also pretty controversial.
Yeah, there are definitely ethical concerns and questions about how accurate and reliable these methods really are. Same with polygraph tests, the lie detector tests.
It makes sense that there would be a lot of debate about how to assess and understand these offenses.
For sure. But let's switch gears now and talk about another type of crime, arson.
Arson, okay. That one seems like it could have some connection to mental health, right? Like setting fires.
You're right, and one researcher, Falk, actually proposed two main groups of arsonists. Those who do it for other reasons, like revenge or fraud, and those who are fascinated by fire itself.
So some have an external goal, and others are more driven by the fire itself.
Exactly. And within that second group, there's a specific diagnosis called pyromania.
Oh, pyromania. That's the one where someone feels compelled to set fires, right?
Right. And according to the DSM-IV, some of the criteria are setting fires on more than one occasion, feeling tense or aroused before doing it, being fascinated with fire, and feeling pleasure or relief while setting or watching fires.
So it's not just about setting the fire. It's about all the feelings that come with it.
Exactly. But pyromania is actually pretty rare. Most arson cases are about those other motives we talked about, like revenge or fraud.
Interesting. So besides pyromania, are there any other common characteristics of arsonists?
Well, research shows that most of them are young adult males, and they're often going through relationship problems or stressful life events.
So life stressors could be a factor.
Yeah, and alcohol abuse is also pretty common in this group.
Okay, so again, we see that mix of individual, social, and situational factors.
Exactly. Now, ready for one that might surprise you? How about shoplifting?
Shoplifting.
Yeah.
Really, I wouldn't have thought of that as being linked to mental health.
Yeah, it's not as obvious as some of the other crimes, but there's some interesting research out there. One study in Montreal found that only about 3.2% of shoplifters had a diagnosed mental illness.
Wow, that's really low. So most shoplifters aren't driven by a mental health issue.
Nope. But for that small percentage who were, there seemed to be a link to things like depression, alcoholism, and drug addiction.
Okay, so it's possible that those struggling with these conditions might be more susceptible to shoplifting.
Possibly, yeah. And then, of course, there's that specific mental health condition related to shoplifting kleptomania.
Ugh, kleptomania. That's where someone has that overwhelming urge to steal, right?
That's it. It's classified as an impulse control disorder, and people with kleptomania feel this intense compulsion to steal, even if they don't need the things or can afford them.
It must be tough to live with that kind of compulsion.
It can be. And it often occurs alongside other mental health conditions, especially personality disorders.
Anything else about kleptomania that stands out?
Well, it seems to be more common in women than men, and it usually involves stealing small, inexpensive things.
So it's not about the value of what they're stealing, it's more about the act itself.
Exactly. It's that irresistible impulse that drives the behavior, not some practical need like needing money.
Okay, so we've covered sexual offenses, arson, shoplifting. What other crimes are we going to look at in relation to mental health?
Let's talk about learning disabilities and crime.
Learning disabilities. That's not one I've thought about much before.
It's often overlooked, but the research shows some interesting links. For example, there's a clear connection between low IQ and delinquency.
So people with lower IQs might be more likely to get into trouble with the law.
Yeah, and studies have also found that individuals with learning disabilities might be more likely to commit certain crimes, particularly arson and sexual offenses.
I wonder why that is.
Well, one possibility is that people with learning disabilities may have a harder time understanding legal proceedings, following the rules of probation, or fully grasping the consequences of their actions.
So they might not fully understand the seriousness of what they're doing.
Right, or they might be more vulnerable to being manipulated or taken advantage of by others.
It sounds like navigating the justice system could be really tough for someone with a learning disability.
Absolutely. And unfortunately, the statistics on recidivism are pretty high for this group.
Recidivism, meaning reoffending.
Exactly. Studies show that offenders with learning disabilities who don't get any treatment have reoffending rates of 40 to 70%.
Wow, that's really high. Does treatment make a difference?
It can. For those who do receive treatment, the rates drop to between 20 and 55%.
So it's still significant, but it shows that intervention can help.
Definitely. It highlights the need for more specialized support and interventions within the criminal justice system to address those specific needs.
Right, it's not a one-size-fits-all situation.
Not at all. Okay, so we've talked about sexual offenses, arson, shoplifting, and crimes related to learning disabilities. Any other areas we should cover?
Well, we've been talking a lot about general trends, but what about gender differences? Are there specific things to consider when looking at female offenders?
Absolutely. That's a really important point and something we should definitely talk about.
Okay, so we were talking about female offenders and how their involvement in crime often looks different than men's.
Right. And one of the key differences is what we call index offenses.
Index offenses.
Yeah. It basically means the crime that landed them in prison. And for women, those index offenses are more likely to be tied to domestic disputes or to be nonviolent.
Interesting. So they're not necessarily committing the same types of crimes as men.
Exactly. And the numbers back that up. 68% of women in prison are there for nonviolent offenses.
Wow, 68%. That's a big difference compared to men.
Yeah, for men, it's only 47%.
Okay, so their pathways into the criminal justice system are often different.
Mm.
What about the victims of those crimes? Is there a pattern there too?
Yeah, when women do commit violent crimes, they're more likely to target family members.
Oh, so it's more likely to be happening within a family context.
Exactly.
That adds a whole other layer of complexity when you start thinking about family dynamics and how those might contribute to the crime.
Definitely. And there are some interesting patterns when it comes to the types of things they steal, too.
Okay, like what?
Well, for instance, when women are involved in property crimes like theft, they tend to steal fewer items and items of lesser value than men do.
That's interesting. So maybe the motivation behind the crime is different?
It's possible. And here's another surprising one. A lot of women in prison, about a quarter of them, are actually there for drug offenses.
Really? I wouldn't have guessed that drug offenses were so common among female offenders.
It's a bigger issue than a lot of people realize. And speaking of differences, women actually tend to receive more lenient sentencing than men for similar crimes.
Wait, really? I thought the justice system was supposed to be harsher on women.
It's a common stereotype, but it's not always true. In general, women are more likely to be diverted to mental health treatment instead of prison, and when they are incarcerated, their sentences tend to be shorter.
So it sounds like there's more of a focus on rehabilitation and mental health for female offenders.
And that's really important because women in custody are actually 5 times more likely to have mental health problems than women in the general population.
5 times. Wow, that's a huge difference.
It is, and it highlights how crucial it is to address mental health needs within the female offender population.
Hmm.
We're talking about really high rates of mental health issues, like up to 80% of women in prison have a diagnosable mental health problem.
80%. That's incredibly high.
It is, and a lot of them suffer from psychosis. On top of that, in 2006 and 2007, almost 20% of women in custody had attempted suicide in the year before they were in prison.
That's heartbreaking. And almost 3 times the rate for men, right?
Yeah, it's clear that there's a lot of trauma and unmet need in this population. And it's important to remember that a lot of these women have been victims themselves. They have histories of abuse, domestic violence, all sorts of trauma.
It's like a tragic cycle. They've been victims, and then their own struggles end up leading them to become offenders.
Sadly, that's the case for a lot of women in the system. We need more trauma-informed care, more support services to try and break that cycle.
Absolutely.
Mm.
It seems like we need a more holistic approach, something that addresses both their mental health needs and the social and economic factors that might be contributing to their involvement in crime.
Couldn't agree more.
Well, this has been an incredibly informative deep dive. We've learned so much about the complexities of crime and mental illness and really challenged some of those common misconceptions.
Yeah, we've seen how mental illness can play a role in criminal behavior, but it's rarely a simple cause and effect relationship. There are so many other factors to consider.
And it's clear that there are important gender differences to keep in mind as well, both in terms of the types of crimes committed and how the justice system responds.
It's a multifaceted issue for sure. And hopefully this conversation has encouraged you to think more critically about these topics and to keep questioning those assumptions.
It definitely has for me. So until next time, keep those minds curious, keep learning, and keep those conversations going.